Hello, everyone. Welcome to Episode 7 of the California CNA Test Preparation podcast. Are you ready to begin? Okay, let's go. Part 1. Today we will study 10 medical vocabulary terms from our medical vocabulary list with definitions and context. Coccyx. Tailbone. Context. The patient developed a pressure ulcer on their coccyx due to prolonged bed rest without proper repositioning. Colonization. A condition when a person carries an infectious agent but is not symptomatic or ill. Context. The screening test revealed colonization with MRSA, requiring the patient to be placed in contact isolation. Colostomy. A surgically placed opening when a client's colon function is impaired. A piece of the colon is diverted to an artificial opening in the abdominal wall called a stoma, and feces is collected in a pouch. Context. The patient learned proper colostomy care techniques before being discharged home after bowel surgery. Commode. A movable device with a bucket underneath the seat that is used for elimination when the client has difficulty getting to the bathroom. Context. The nursing assistant placed a commode beside the patient's bed to provide easier access during nighttime bathroom needs. Communication. A process by which information is exchanged between individuals through a common system of symbols, signs, or behavior. Context. Effective communication between the healthcare team and family members was essential for coordinating the patient's care plan. Comorbidities. Coexisting health conditions. Context. The patient's diabetes and hypertension were significant comorbidities that complicated their recovery from surgery. Compression stockings. Stockings that apply gentle pressure to a limb to reduce edema, also referred to as thromboembolic deterrent, TED, hose. Context. The patient wore compression stockings during their hospital stay to prevent blood clots from forming in their legs. Contact precautions. Transmission-based precautions used for clients with known or suspected infections transmitted by touch, such as C. difficile, C. diff, methicillin-resistant Staphylococcus aureus, MRSA, vancomycin-resistant Enterococcus, VRE, or norovirus. Context. All staff entering the patient's room followed contact precautions by wearing gloves and gowns to prevent spreading the C. diff infection. Cyanosis. Blue coloration around the mouth and in the extremities, i.e., feet and hands, that occurs when there is decreased oxygenated blood flow to the tissues. Context. The nurse immediately called the physician when she noticed cyanosis around the patient's lips, indicating poor oxygenation. Daily weights. Client weight taken at the same time every day, on the same scale, in similar clothing, and before any food or fluids are consumed. Context. The patient's daily weights were monitored closely to assess their response to the new heart failure medication. Part 2. CNA Skill 5. Now let's focus on CNA Skill 5. What is CNA Skill 5? CNA Skill 05. Skill 5. Cleans upper or lower denture with the patient. 1. Introduce yourself and explain the procedure to the patient. 2. Perform hand hygiene. 3. Put on gloves. 4. Place all supplies on a barrier. 5. Place a clothing protector on the patient. 6. Line the sink with a washcloth or paper towel. 7. Ask the patient to remove dentures and place them in the cup. 8. Handle the dentures carefully to avoid damage or contamination. 9. Wet the denture brush and apply denture toothpaste if available. Water alone is acceptable to clean dentures if toothpaste is not available. 10. Thoroughly brush the inner, outer, and chewing surfaces of each denture. 11. Rinse the dentures using clean, cool water and place them on a clean barrier or in an emesis basin. 12. Rinse the denture cup. 13. Place the dentures in a rinsed cup. 14. Put a denture cleansing tablet in the cup if desired. 15. Rinse the equipment, denture brush, and emesis basin. 16. Return the equipment to storage. 17. Discard the protective lining in an appropriate container. 18. Remove the gloves, turning them inside out. 19. Perform hand hygiene. CNA Skill 5 Short Dialogue. 5. Cleans upper or lower denture with patient. CNA. Good morning, Mrs. Garcia. Time for your denture care. I've lined the sink with a towel to prevent damage if we accidentally drop them. Patient. I'm glad you know how to handle them properly. CNA. I'll be very careful. I'm using the denture brush with just a little toothpaste to clean all surfaces thoroughly. The water is nice and cool for rinsing. CNA Skill 5 Extended Dialogue. 5. Cleans upper or lower denture with patient. CNA Patricia. Good morning, Mrs. Garcia. It's time to clean your dentures after breakfast. Mrs. Garcia. I worry about them getting damaged during cleaning. CNA Patricia. I understand your concern. I've lined the sink with a washcloth to cushion them if they're accidentally dropped. I also have all our supplies organized on this barrier. Mrs. Garcia. That makes me feel better. Should I remove them? CNA Patricia. Yes, please place them in this cup. I'm going to handle them very carefully to avoid any damage or contamination. Mrs. Garcia. What kind of cleaner are you using? CNA Patricia. I'm using denture toothpaste with this special denture brush. I'm thoroughly brushing the inner, outer, and chewing surfaces of each denture. Mrs. Garcia. The water isn't too hot, is it? CNA Patricia. No, I'm using cool water for rinsing, which is safest for dentures. Now I'm placing them in this clean cup with fresh water. Dental hygienist. How was the denture cleaning process? CNA Patricia. Very thorough. I cleaned all surfaces, used appropriate water temperature, and Mrs. Garcia was comfortable throughout the process. Thank you for listening and studying with our podcast episode. Stay tuned for more episodes coming soon your way.